Documenting Home and Community-Based Services, a training for support service workers and managing employers in the Agency with Choice program. The objectives for this training are for support service workers, or SSWs, to be able to understand the difference between the different types of services and the correct documentation for each of those services. It is also important for managing employers to understand the documentation requirements so that they can correctly manage the daily activities of the SSW and ensure that the ISP is being followed. We want you to understand what you are documenting about, how to document it, and why you need to document. What you are documenting is the type of support, assistance, and activities that you are providing to the participant during your scheduled working hours. Noting the participant's level of involvement, response to, and achievement to the support that's being provided is how you document. There are two primary reasons for documenting services. One, a review of progress notes is necessary when planning outcomes during the ISP meeting to determine if a particular outcome is appropriate, has been met, needs to continue, or needs to be revised. The second reason, quite simply, is that this service is being funded by the state and federal government, and they want verification of how these services are being used. The first thing you need to know is what are the outcomes in the participant's individual support plan, or ISP. An outcome is a goal. It's something the participant wants to achieve. The participant could have one or many outcomes. It depends on each individual's wants and needs. The managing employer will review the ISP outcomes with you during your initial training and any time after that as needed if there are changes. If either the SSW or managing employer have questions or need assistance with the ISP training, please contact your local Agency with Choice office and we will be happy to help. The ISP outcome is related to the type of service that you will be providing. The commonly used services are respite, companion, and habilitation, which we will review in this training. There is a complete list of available AWC services on the training site for your reference. Respite services are used to give the primary caregiver a break. This service ensures the participant's needs will be met while the primary caregiver is away, whether it be for a vacation or just an evening out. Meeting the participant's needs means that you would provide the usual assistance and support required in that participant's daily life and follow the normal daily routine. There are two types of respite, 24-hour or day respite and 15-minute respite. 24-hour respite is used when an SSW provides 16 to 24 hours of service at a time. If the service that is needed is less than 16 hours, then 15-minute respite is used. Please make sure you are using the correct service type as indicated in the ISP. Respite service can also be in-home, meaning provided in the participant's home, or out of home, meaning the service is provided in the home of the SSW. These are two specific service types, so again, please be sure you are using the correct service as indicated in the ISP. Companion service provides supervision and assistance that is focused on maintaining the participant's health and safety. Companion services are used in place of habilitation services when a habilitative outcome is not appropriate or feasible, which means when the participant is not learning, enhancing, or maintaining a skill. This service type provides supervision and assistance to carry out daily activities such as grooming and hygiene, meal preparation, household chores, social or recreational activities, and so on. Habilitation refers to actively working with the individual to improve current skills or obtain a new skill. Outcomes are individualized for each person but are often related to increasing independent living skills. This can range anywhere from learning to be more independent in daily grooming activities, cooking, or household chores, to learning money management and budgeting skills, to learning independent use of public transportation services, to increasing ability to communicate using devices, to learning about and making use of local resources, to learning to make choices in day-to-day activities and routines, and you get the idea. The primary difference between habilitation and companion service is that habilitation includes teaching, learning, and practicing in order to maintain or improve skills, whereas companion service provides assistance to the participant with whatever is needed with the daily normal routine, without the primary purpose of increasing the participant's skills and abilities. The Office of Developmental Programs, or ODP, has specific requirements when it comes to documenting the provision of service. These requirements include the name of the participant receiving the service, the name of the provider, the name, title, signature, and date of the person completing the progress note, the name of the service, the amount, frequency, and duration of the authorized service, the outcome of the home and community-based service, and a description of what occurred during the delivery of the service. The daily activity log that you are asked to complete meets these requirements. It doesn't have to be complicated. It should be simple and straightforward. Cite facts and observations, not your personal opinions. Write a brief summary of the activities that occurred during your shift, not everything that happened every 15 or 30 minutes. Documentation should be focused on the participant, not anyone else in the household or other SSWs. For habilitation service, document how the participant is working to meet their outcome, their responses, their progress, their achievements. Let's review some documentation examples. We did say that respite service is used to ensure the participant's needs are being met. However, you can still be brief and to the point by including some of the things you did to meet the needs and follow the normal routine. 24-hour respite is documented on a different type of log than habilitation or companion. You'll see multiple lines for start and stop times. This is for documenting or clocking out when the participant is sleeping, whether it be a nap during the day or normal overnight sleep. If you must awaken during the night to assist the participant, clock back in and then clock out again when you have finished providing the necessary assistance. The purpose is to monitor the amount of sleep you are potentially given during a 24-hour period to make sure you and the participant are not being placed in an unsafe situation due to not getting an appropriate amount of rest. Same thing in documentation with companion services. Instead of just writing that you ensured the participant's health and safety, write a brief summary of the activities you and the participant did during your shift. It's also helpful to include the participant's responses sometimes. For habilitation, it's important to document to what extent the participant is involved in the activity so you can measure progress. If the outcome is to increase independence by choosing an appropriate outfit for the day, then noting that you helped pick an outfit doesn't really tell us anything about what Mary did to achieve her outcome. Documentation does not have to occur every 15 minutes. However, your note should adequately explain the service during the time frame it was provided. Here's another example. This note contains information about how Mary participated in and responded to various activities throughout the day. This note would be appropriate documentation for a rehabilitation outcome related to increasing independence in self-care and household chores, making appropriate choices, and increasing socialization skills through community activities. Before we wrap up, let's go over a few other important things to remember when providing home and community-based services. It is very important to follow the amount, frequency, and duration of the service as noted in the ISP. This information is noted on the daily activity log as a reminder for you. If a participant has a significant change in condition or primary caregiver availability, for example, and has a need for additional services, the managing employer must contact the supports coordinator immediately to discuss the situation before simply using additional services. Repeatedly exceeding the amount of service authorized can result in running out of services before the end of the fiscal year and can also result in disciplinary actions for noncompliance for SSWs and managing employers. It is important to submit your daily logs on a timely basis every week. Make sure logs are complete with accurate dates and times and are signed by both the SSW and managing employer. One more reminder about home and community-based services. The service should be provided in the home of the participant or within the participant's community, not in the home of the SSW, except in the case of out-of-home respite, which specifically states the service can be provided outside of the participant's home. Habilitation and companion service should not be provided in the home of a SSW unless the need for and appropriateness of it has been fully discussed and agreed upon at a key meeting. Reasons such as being more convenient for the SSW has small children at home to care for, or the participant wants to go to the SSW's home to play with the dog would not be acceptable reasons. Hopefully what we achieved today is an understanding of the what, why, and how of documentation. Keep it simple and objective. Remember, the primary purpose of documentation is to measure how the participant is progressing toward his or her goals. Follow the ISP and don't provide more hours of service than are authorized. Make sure your paperwork is complete, signed, and submitted on time. If you have any questions regarding documentation, please contact your local Agency with Choice office. Thank you for participating in this training.